In early 2026, the $50 billion supplement industry is facing its biggest regulatory shakeup in decades. The FDA's Human Foods Program 2026 Priority Deliverables has initiated a sweeping reassessment of common additives, while several high-profile recalls for bacterial contamination, like the January 2026 Moringa outbreak, have put natural brands on notice. While vitamins can bridge nutritional gaps, many popular pills are now considered expensive urine at best and dangerous toxins at worst. Quick favor before we move on. If you appreciate this content, consider giving this video a like and subscribing to the channel. Believe it or not, more than 92% of viewers haven't subscribed yet. It's free and only takes a second, but it means the world to us. So did you subscribe already? Great. Thank you so much for your support. Now back to the video. Here are the 7 vitamins and supplements you should avoid in 2026 and the science-backed alternatives that actually work. 1. High-dose vitamin B6, synthetic. The verdict: in 2026, doctors are issuing urgent warnings about vitamin B6 toxicity. While B6 is essential, many over-the-counter supplements contain 50 to 100 times the daily requirement. Unlike natural B6 found in food, the synthetic version, pyridoxine HCl, used in many stress B-complex pills, can accumulate in the body, leading to peripheral neuropathy, a condition causing permanent tingling, numbness, and nerve damage in the limbs. High-profile 2025 to 2026 medical reports have highlighted patients losing mobility due to oversupplementing for energy. Unless you have a medically diagnosed deficiency, avoid any supplement providing more than 10 milligrams of B6 daily. Instead, get your B6 safely from chickpeas, tuna, and poultry. 2. Proprietary blend immune boosters. The verdict: the 2026 market is flooded with immune support powders and gummies that hide their dosages behind proprietary blends. These are a major red flag because they allow manufacturers to include minuscule amounts of expensive ingredients while loading the product with cheap fillers or hidden stimulants. Recent FDA lab tests found that nearly 37% of these natural blends were adulterated with unlisted chemicals. Furthermore, the high sugar content and citric acid in popular fizzy immune tablets can erode tooth enamel and disrupt gut health. If you want to support your immune system, stick to a single-ingredient vitamin C or zinc supplement from a third-party tested brand, like USP or NSF certified. 3. Weight loss patches and GLP-1 dupes. The verdict: one of the most dangerous trends of 2026 involves transdermal weight loss patches claiming to provide GLP-1 Ozempic-like effects. The FDA officially stated in February 2026 that no GLP-1 patch has been approved for safety or efficacy. These stickers often contain high doses of unlisted caffeine, guarana, or Garcinia cambogia, which has been linked to rare but severe liver failure. The skin absorption for these botanicals is incredibly weak, making them a waste of money, while the hidden stimulants can cause heart palpitations and anxiety. For sustainable weight management, focus on a high-protein diet and consult a doctor about FDA-approved metabolic treatments. 4. Synthetic vitamin E, alpha-tocopherol. The verdict: long touted as a heart health hero, vitamin E in supplement form is now largely discouraged for the general public in 2026. Clinical studies have shown that high-dose synthetic vitamin E can actually increase the risk of hemorrhagic stroke, bleeding in the brain, and may interfere with the body's natural antioxidant balance. It can also reduce the effectiveness of chemotherapy and blood-thinning medications like warfarin. Unless specified by a cardiologist, avoid standalone vitamin E pills. You can easily meet your daily requirement through a handful of almonds or a tablespoon of sunflower oil, which provides the vitamin in its natural, balanced state. 5. Moringa and super green powders, or called lots. The verdict: 2026 began with a major salmonella outbreak linked to Moringa leaf powder, leading to mass recalls of popular super greens brands. Beyond the contamination risk, these powders are often nutritional chaos. They pack dozens of botanicals into one scoop, making it impossible to know which ingredient might be causing a reaction or interacting with your prescriptions. High-dose green tea extract, a common filler in these powders, is a leading cause of drug-induced liver injury in the U.S. in 2026. If you want the benefits of greens, nothing beats the fiber and safety of actual spinach, kale, and broccoli. 6. High-dose vitamin A, retinol, supplements. The verdict: vitamin A is fat-soluble, meaning your body stores the excess in your liver rather than flushing it out. In 2026, the liver load from high-dose retinol supplements is a growing concern. Excessive vitamin A intake can lead to bone thinning, osteoporosis, severe headaches, and, in pregnant women, significant birth defects. Most Americans get more than enough vitamin A from milk, eggs, and pre-vitamin A carotenoids in carrots and sweet potatoes. Standalone vitamin A supplements are almost never necessary for adults and can quickly reach toxic levels if taken daily alongside a fortified multivitamin. 7. Inorganic, gummy multivitamins. The verdict: gummy vitamins may be fun, but in 2026, they are considered the least effective way to supplement. To make them shelf-stable and tasty, manufacturers often use titanium dioxide, a whitening agent being banned in several states, and high-fructose corn syrup. Because gummies are difficult to manufacture consistently, they often contain lower nutrient levels than what is listed on the label, or they are oversprayed with vitamins to compensate, leading to inconsistent dosing. The sugar and acids stick to your teeth, promoting cavities while providing a sugar spike that offsets any health benefit. Switch to a high-quality, third-party tested capsule or tablet instead. What's actually safe to take? While the list of no-goes is long, a few essentials remain the gold standard for safety in 2026. These are the supplements most doctors agree have the highest benefit-to-risk ratio. Vitamin D3, especially during winter or for those working indoors. Aim for 600 to 2000 IU daily. Magnesium glycinate, highly absorbable and gentle on the stomach, excellent for sleep and muscle tension. Omega-3, molecularly distilled, crucial for heart and brain health. Look for brands that test for mercury and PCBs. Vitamin B12, a must-have for vegans, vegetarians, and adults over 50 who may have trouble absorbing it from food. The 2026 supplement landscape serves as a vital reminder that natural does not inherently mean safe. As we have seen with the vitamin B6 toxicity reports and the Moringa contamination recalls, the lack of rigorous pre-market testing in the U.S. puts the burden of safety entirely on the consumer. The 2026 regulatory shift is finally exposing the ultra-processed nature of many retail vitamins, particularly gummies and proprietary blends. These products often prioritize flavor and shelf life over biological efficacy, leading to a supplement trap where users pay a premium for potentially toxic additives and ineffective dosages. Ultimately, the 2026 philosophy for wellness is food first, science second. Supplements should be viewed as a surgical tool, targeted, specific, and used only when a gap is clearly identified through blood work. Success in your health journey this year isn't about how many pills you can take, but how many you can safely eliminate. By focusing on third-party tested, single-ingredient essentials like vitamin D3 and magnesium, you can avoid the chemical noise of the supplement aisle. In 2026, the most powerful vitamin is often the one you decide you don't need to buy.